So, what do I mean? That in the summertime, people could experience some heightened health problems. This statement I'm making because of what I've observed has been happening on the places I have visited and in the places where I stay, uh, and something that is a natural part of how things are unfolding globally. I'm pausing right now because my energy is getting drained a lot today, and I don't know if the universe doesn't want me to post this video, but if I don't post this video, serious health crisis will be unfolding and has been unfolding in the globe, but people are just simply unaware about it. Because if you have watched any memes during the COVID crisis or in the last few years, you might have seen some memes regarding how I saw a couple of memes about a girl made in Germany about her German boyfriend sweating profusely in the German summers, while she, being Vietnamese, was pretty not sweating as profusely as him because having come from a tropical climate, the German heat wasn't too much for her. And then there was another video made by a British person who was making a meme on how during the summer times, even though Britain gets very few weeks of summer, the people are not able to handle the heat, and people are buying a lot of coolers and things like that. So they were both memes, but they are the truth of the matter that globally people might have observed themselves, that they have started increasing the use of air conditioners during summertime, or when they are going out on trips and vacations during summer. We are all choosing to have AC vehicles for it, or we are sweating a lot profusely when we are visiting any national monuments, national parks, or any popular place of visit and tourism globally. Now, why is this happening in the summertime? Most of us have chalked it out that because it is summer, the weather is hot, or because we're visiting a different country and we're not used to the weather of that country, or because we had a really long, cold, cool winter, our body is not able to handle the summer heat. But while it is partly true that all these reasons could be at play, or some of these reasons could be at play when we are sweating profusely during the summer, the secondary reason for us feeling this intense heat and sweating happens if we have pesticide exposure from our food, water, air, clothing, the places we are visiting, and our hands and foot touching the surfaces where pesticides have been sprayed. All of these combined are causing us to have increased sweating, because the first symptom of acute poisoning from any pesticides is, one of the symptoms could be intense sweating. And many a times when we are traveling also globally, we also experience something called the stomach flu. Everyone terms it as stomach flu or diarrhea when they are traveling, or food poisoning. But even though we term it as stomach flu, diarrhea, food poisoning, and it is possible that if your food wasn't cooked in a hygienic manner, it could have had bacterial contaminants in them, which could result in the diarrhea, or the food could have had some viral contents in them, which could result in stomach flu. But this is the third thing that no one analyzes or hasn't analyzed in a long time, is that if our food or the water we are drinking, or the water we are bathing in when traveling, or the water we are using to wash our clothes when traveling, if any of these waters had any pesticide contamination or any other additional pesticide plus other chemical contaminations in them, that water that was used for cooking, drinking, making our tea, making our cold drinks, making our lassis, making our soups, making our boiled vegetables, making our pastas, making our that same water used for our washing the utensils we are eating our food in, washing the clothes and linen we are sleeping on. All of these, if they have been washed by chemically polluted water, or cooked in chemically polluted water, or prepared in chemically polluted water, every degree of polluted water used in any of these areas has invariably also entered our body via the things we have consumed, or the clothes we are wearing, or the bed we are sleeping on. And depending on the number of pollutants our body is getting exposed to, we get a number of symptoms, and also depending on our personal health status. So today I'm extremely tired because there is water pollution going on, not only from my tap water, but water pollution is also present in some processed drinks that I have bought from a store. And now, if that drink's manufacturer is aware about a chronic pollution problem in their area, and knows, also is aware that the filtration devices they are using may not be filtering out all the pollutants in the water, then they will do something about it if they are aware that there is a water pollution problem in their product. But if they are not aware, or even if they are aware, they are ignoring that problem, then what happens is many of us might continue to consume a product where nothing has been done to recall the product, nothing has been done to improve the quality of the product, nothing has been done to solve the problem of water pollution that could be impacting a health drink that we are buying from a company. Same thing also true with milk. It could be milk you are buying directly from a dairy, buying indirectly via a large scale manufacturer of the milk. Both these milk products, sometimes I have found, can have chemical contaminants in them. I've gone and drunk in even expensive facilities like Starbucks in India, and they charge like almost 10 times or 20 times more than what a common coffee shop or a roadside coffee person will charge. But if the chemical contamination of the water used or the milk used by a roadside vendor or the restaurant owner or a Starbucks like place is the same chemical contamination, then, or similar level chemical contamination, because they are sourcing their milk from the same vendor, or all the vendors who provide the milk are doing farming in the same area of the state from which all these products are coming from. All of these are the factors that will be impacting all of our health. And it doesn't matter if you buy a 50 rupees coffee or you've bought a fancy coffee with additional accompaniments which is 500 rupees. Both of them, the 50 rupees one and the 500 rupees one, if they have chemicals in them that are harmful for our health, my health is going to deteriorate irrespective of the money I spent on it. Same is true for food. When we are traveling, even when we are not traveling, when I'm living in my normal home in Mumbai and Navi Mumbai area, and I'm going and eating out in a restaurant, or I'm going and purchasing some vegetables for cooking food at my home. Say the local restaurant that I go and eat a pav bhaji makes a very yummy pav bhaji, and I'm feeling too lazy or I'm feeling too sick, So I went there and ate their pav bhaji. Say when I'm healthy, 2 days later, I'm making that same pav bhaji at my home, and I'm using almost the same spices because we both, the local restaurant person and I, we both go to the same farmers market, or we both go to the same farmer and vegetable vendor on the streets, because that's very common in India, or we both are using similar spices because we are going to the same retail store to buy those spices. If all of our ingredients are also not from the same vendor, maybe 30 to 50% of our ingredients in the same locality will be coming from the same vendor. So whatever ingredients he used to make pav bhaji, and if I'm using exactly the same ingredients that he is using, and there is a 30 to 50% match in the sauce from which that dish is being prepared, we both will have the same health problem. Now if the restaurant is more cleaner and hygienic in their practices and ensures that the water and food quality is as clean as possible, more, and doing that more than I am doing it, I'll stay healthier eating the restaurant food. If I am more careful, more hygienic, more aware of the chemicals in the food I'm using, and I'm more aware of avoiding chemicals in my food, then the food I prepare will be more hygienic. But in all this also, if both of us are getting the same municipal supply of water, living in the same Navi Mumbai area, I'm living in the same area, he's working in the same area, and if both the kitchen chef and I am using that same water in that area, and that water has been polluted because the summer months are approaching, chemical usages have increased, because before farming or before people start planting new crops in the springtime, when farmers are starting to plant crops, they start spraying chemicals in the air. So two things are impacting the water supply of our area. Two main things of area where farming is going on is impacted is by the farmer themselves having increased their chemical spraying. Second place where it is impacted is our water supply is diminishing on earth as summer is getting closer and closer. So the more closer we are going to summertime, the concentration of chemicals is also increasing by itself on any food we eat, any food we consume, any water supply we are getting, which is bypassing any areas where pesticides have been sprayed. Because it's not just a farmer who sprays pesticides in India, government also sprays it, municipality sprays it, someone's home might be spraying it, some business establishments might be spraying pesticides, and the businesses where food and grains are stored, they might be spraying pesticides to keep their store clean. So all of these pest control activities are continuously happening on earth, and continuously increasing the concentration of chemical load on earth. And COVID happened partly because the chemical concentration inside the body that has accumulated over decades of exposure to these chemicals from food and multiple sources, when in someone's body it was really high, like it became in my body, I was getting all these cardiac problems, respiratory problems, liver problems. These were the and blood related health issues, as well as a slowly developing cancer. Now I am aware about this. I knew what is going on with my body, and I am studying what is going on in my body because I'm not working, so it's easier for me to observe this. But most of us who are leading a very busy life, raising kids, going to work, they don't have the luxury to sit and observe this. If they get a symptom, they go to a doctor, and sometimes if the doctor is aware that your symptoms are from certain sources, or they might give you something, or if the doctor is not aware where your symptoms are stemming from, Most of us assume it's a weather change, most of us assume it's seasonal change, most of us assume it's pollen allergies, because allergy like symptoms of sweating, redness of eyes, diarrhea, or they will assume it's some kind of seasonal flu. These are the medications that will be prescribed normally to anyone who will go to a doctor as soon as they're getting some chemical poisoning, environmental toxin related poisoning. But the thing is, our body is all slowly getting toxed out, and as we reach closer and closer to summer, I would request each and every one of you to start observing your own health. Maybe keep a health diary. Maybe write here in the comments what symptoms you're facing in the part of the world you are seeing this video from, because it is very important that you start becoming mindful about how the chemicals in your environment, chemicals in your daily life are impacting your health. And if not your health, observe someone who is sick in your family. If you know someone who had long COVID, if you know someone who had been sick with COVID for even some moderate symptoms of COVID, these people are at heightened risk from any chemical pollution increase that will happen from March to the summer months of May, June in countries like India or any other country where chemicals are currently being sprayed during farming activities. Many governments in India, also in certain states, people have understood the value of organic farming and chemical free farming. So people are trying to take initiatives to grow plants, vegetables, home gardening, fruit plantations. All these they are trying to grow them free of chemicals. But if your land area has already had decades of chemical exposure prior to your starting the farming, that impact also will happen to your organic farming initiatives. Also, if there's only one or two farmers doing organic farming in a particular couple of acres of land, whereas 90% of the other farmers in that area are not doing organic farming, then the chemicals used by them also will invariably impact via air and water, because air and water mixes and mingles everywhere on earth. So even if you keep your soil area free of chemicals, the water and air can get cross contaminated from chemicals by other farmers. And the third thing is, there is also some farmers, if they got a ban legally by a place, and say there were 10 chemicals that were banned by that government, but in farming there could be a list of 50 to 100 chemicals that are still available that have not been banned by the government. So certain farmers who are so used to using chemicals, what they will do is they will be using the other 50 chemicals that are not banned, or someone will convince them to use the other 50 chemicals. If a chemical factory is selling it to the farmers, they will convince them to use the other non-banned chemicals. Now this creates also a problem, that all it has done is, if the government of a particular state or a particular country has decided that these 10 chemicals shouldn't be used, but the farmers are legally or illegally, or just by using the loophole of the law, using some other chemicals which haven't been banned yet, it doesn't make it a organic chemical free farming, and it doesn't make the food that you will get from that organic farming label or that pesticide free farming label as food that is truly healthy for you. Because other than pesticides, the other chemicals that are used are fungicides, and fungicides have their own story. I haven't yet deeply researched the fungicide story, and whatever I have researched, it is equally harmful to us. I'll post a video on that in the next one. But if people want to stay healthy, they have to slowly, step by step, make changes in their personal lives, in their professional lives, in if you're doing farming or gardening activities, if you're doing home cleaning activities as a homemaker, if you are responsible for the elderly and kids and unhealthy people in your family, and you want them to have a good health, you have to understand where are the places where you are falling sick. And some of the places I visited last year were also some places I had visited previously, long before COVID started. And at that time, though I was not physically as unhealthy, I hadn't reached the pre-cancer levels or any heightened inflammation, cytokine storm levels, or organ damage levels. Even though, say, 5 7 years back, when I visited this state of India, or even the same city that I visited, revisited again, in those 5 to 7 years of time span, while my health has deteriorated, my sensitivity level to toxins has increased. But even now, when I recollect the time when I had gone to these cities or villages or tourist destinations, I now realize that the chemicals in the environment were impacting my health at that time too. But because I was healthier, what exposure was making me only minorly sick and leading to sweating or stomach upset or sneezing or red eyes or body ache, minor body ache or pain or minor skin irritation. That same thing is 10 times more now, 7 8 years later, when has my body's systems are much more weakened. So if anyone is unhealthy in your family, starting to become unhealthy, did go through COVID symptoms, is going through long COVID symptoms, or going through some other healthcare illness, the more increased awareness you will have about which chemical exposures are impacting your health. And if after having that awareness you start reducing or stopping usages of those chemicals, you will slowly start seeing an improvement in your health. I was able to stay healthy in the last 4 years, and less cancer like and organ damage like symptoms are happening to me during winter times or times after the rainy season has passed, and enough water levels are there on earth, less chemical usages are there on earth, leading to my health being much better. But the moment any city or town or village or society or home, because I went and stayed in homestays and was doing a little bit of budget traveling also, so the chemical usages were happening in from multiple sources in the places I visited. And when any of these or all of these places are increasing their chemical usage, immediately within a day or two I would fall sick. And sometimes it can also be immediately within an hour. Like today, what I consumed in the morning is completely draining my energy and causing some cardiac problems and also maybe slight respiratory problems, because that chemical in that drink that I had is impacting majorly the organ that is already in distress. And that's why immediately within 1 hour of consumption I am feeling sick. Same way, if I was drinking the same drink, which I have done that also, I've observed this as a consistent problem. I have tried to contact the manufacturer about it as well, but these manufacturers have very standard replies about problems. They don't understand. I am a scientific person, I'm an operation oriented person, so when I actually suggest to some company that there is a problem, I have given them actually a list of problem areas where they can actually focus on to resolve that problem. But all standard customer service people from any company have contacted when they have had chemical pollutants in their products is that we will look into it, or we will replace the product for you, send us your address, or we'll compensate you for it. That's it. These are the only three responses they have, when actually that is not a meaningful customer solution for any problem that has multiple health repercussions, and any problem, not just health repercussions, it could be customer repercussions, where Indian customer service is really crappy and doesn't know what customer service actually means. Because when customer addresses a problem, there should be customer service people who should be trained to understand deeply which is a escalation level problem and which is not a escalation problem. There are some people who understood the escalation level when I spoke to them, but if their managers don't understand it, then again it gets stopped. And in India, being a very hierarchical society, even if I mention the company right now on in the video, nothing will happen if the company's CEO didn't get the message, or if the company's CEO is himself not aware what his company is doing, or where his company is going wrong, or why his company needs to change their policies. Because these are the places where any company fails for any level of customer service. And because I was traveling, I faced multiple customer service issues in multiple disciplines, and I faced it because I am a business person. I'm both a business person, I'm also a healthcare person, I'm also a scientist. That's why God also gave me these diseases to observe and speak on, because I have the time to sit and examine it, look at it deeply, analyze it deeply, understand it deeply, know where things are going wrong. And I'm writing and posting these videos. I write also about these in my LinkedIn and other social media, because it's important that people who have some free time to sit and listen to a video or read a post, they start taking agency for their own healthcare. Or if you are working in any organization where you're receiving customer complaints during summertime about your products, please connect with me. I can tell you why it's happening, where it's happening, what is the root cause, root source, and what you need to fix, if the video didn't give you any clues about it. Anyways, hope this video was insightful. I want people to have better health. Everyone can have really good quality of health, but only when our food, water, clothing, shelter, environments where we live in, environments where we travel in for even leisure activities, if they are healthy and clean and hygienic and health supporting, then only all these activities are beneficial for our health. There's also this reason why the travel and tourism industry and the food industry had to shut down during COVID. While the governments didn't know why they had to shut down these things, or they very superficially understood why all these businesses had to shut down, the reason why all businesses related to health and hospitality and hygiene had to shut down temporarily is because they were not providing the right hygiene, health, caretaking services and conditions necessary for a moderate health person to have a good experience with them. And I was someone who had cancer, and I traveled with cancer to all these places, or pre-cancer, depending on how you look at my report or how much you believe my story. But even though I had this disease, I had multiple organ damages going on, and I have visited a couple of different good upscale restaurants, hotels, as well as simple homestays. But the problem of earth pollution and lack of understanding and perception about what adds to someone's good hospitality and what detracts from it, I understood it deeply as well. And there are multiple things that detract while people are traveling, and if travel industry, hospitality industry doesn't fix it, not only are the customers going to have ill health, the second layer is the people who are functioning in these industries are also now functioning with poor health as a result of poor health supportive conditions being practiced in those industries. About this also I'll make a next video. But if you do have any questions after listening to this video, please drop a comment so that I can help address them in my next videos. Thank you very much and have a good day.